It's 7:52 in the morning, and you're lying on a gurney in a hallway, in a gown that doesn't close at the back. Someone has drawn on your leg in marker. There's a plastic band on your wrist with your name spelled slightly wrong, and you decided not to mention it. A nurse asks your date of birth for the fourth time this morning. You give it. She smiles. It's fine. It's routine. They roll you through the doors, and the room is colder than you expected, and brighter. There are more people in it than you thought there would be. Someone puts a mask near your face. Someone else says you're going to feel something cold going into your arm. They ask you to count backwards from 10. You get to 7. And then there's nothing. Not sleep, not darkness, not dreaming. Just a piece cut out of you and thrown away. And then, at a moment you will never be able to find again, the sound comes back. Metal touching metal. A voice saying a number. Music, low. Somebody's playlist. A song you actually know. And you think, that's strange. I'm supposed to be asleep. So you open your eyes. Nothing happens. Not the heavy way eyes are hard to open in the morning. Nothing. You send the instruction and it doesn't arrive anywhere. You try again, harder, the way you'd try harder at anything, and there is simply no connection at the other end of it. You are awake. Here's the part almost nobody knows about the room you're lying in. General anesthesia isn't one drug that switches you off. It's 3 separate jobs done by 3 separate sets of drugs. One to take away consciousness, one to take away pain, and one to take away movement, a paralytic, so that your body stays completely still while someone works inside it. 3 jobs, 3 systems. They can come apart. And the one that has come apart right now is the first one. The paralytic has no opinion about whether you're conscious. It has never had one. It goes to your muscles and it turns them off. Your arms, your legs, your face, your eyelids, your vocal cords, and your diaphragm, which means you are not breathing. A machine is breathing for you on a schedule at a rate a person set on a dial, and it will not go faster because you are frightened. Think about what that removes. You can't scream. You can't flinch. You can't gasp or hold your breath or hyperventilate. Every single thing a body does with panic, you've been sealed off from all of it. The terror is at full volume, and there is nowhere in your body for it to go. And so the monitors show a calm patient. Everyone in that room is looking at a screen, and the screen says you are fine. Then you feel them start. It's usually not the clean, bright pain you're imagining. People describe pressure, pulling, heat, a deep, wrong tugging, like someone moving furniture in a room you live in. Your body is being handled, and it is being handled well by people who are good at this, and you are present for all of it. So you try to signal. This is what everybody does. You pick the smallest thing you own, and you pour everything into it. 1 finger. Just move 1 finger. There are studies where doctors deliberately keep this door open, a tourniquet on 1 arm before the paralytic goes in, so that arm alone can still move. It's called the isolated forearm technique. When they ask those patients to squeeze, a startling number of them do, and most of them remember nothing about it afterwards. But you will remember. You spend what feels like an hour on that finger. There is no clock. There is no order to anything. Sounds arrive out of sequence, and time stops behaving like time. And somewhere above you, 2 people are talking about the weekend, about a parking space, about somebody's kid turning 6. Ordinary, kind, competent people having an ordinary Tuesday, 6 inches from your face, and not one of them knows you're in here. Here's what nobody tells you about being awake on that table. It isn't the pain. Ask people who have actually lived through this, and very few of them lead with the pain. What they describe is the aloneness. The precise, airless aloneness of being in a room full of people who are touching you, saying your name, working hard to save your life, and being completely, perfectly unreachable. You weren't abandoned. That's the thing. You were surrounded, and it made no difference at all. It ends the way it started, with no announcement. The drug catches up, or the surgery finishes, and they give you something to reverse the paralysis. And the small muscles come back first, the eyes, the hands. Then a warm blanket, a recovery room, a nurse asking you to rate your pain from 1 to 10. And you try to tell them. And this is where a lot of people meet the second injury, which is quieter and lasts longer than the first. You were probably dreaming. That's the drugs. It happens. That's not really possible. Depending on how you count it, this happens to somewhere between 1 in a few thousand and 1 in 20,000 people who go under. It's higher for certain surgeries, emergency cesareans, heart surgery, major trauma, where they can't give you as much without putting you at risk. And around 4 in 10 people who experience it are still carrying psychological damage from it much later. That number climbs when nobody believes them. Here's what nobody warns you about. What it takes from you isn't a fear of hospitals. You'll go back, you'll have other surgeries, and most of them will be nothing at all. What it takes is an assumption you didn't know you were making your whole life. That a person who isn't responding isn't there. That stillness means absence. That if someone can't answer you, there's no one home. You know now, in your body, in a way you can never talk yourself out of, that a human being can be completely present, thinking, terrified, listening, counting the seconds, and give off absolutely no sign of it. That being there and being able to prove you're there are two entirely different things. And most people never have to learn that. So it changes something small in how you move through the world. Your grandfather in the last months, when he stopped answering. The friend in the ICU with the tube. The stranger in the chair everyone talks over, in the third person, while she's sitting right there. You used to assume nobody was home. You will never assume that again. So when you're in a room with someone who can't answer you, you talk to them anyway. You say their name. You tell them what day it is and what the weather's doing and who's in the room with them. You have no proof it lands. You do it anyway. Because once, everyone in the room looked at you and saw nobody home. And you were the most awake you have ever been.